Hi, this video is especially for Amilie, but it's also for people that want to kind of understand or have wondered what dentists are talking about, that jargon they use, those words they use, that code that they use. So I'm going to try and break down some of those terms into simple terms that we can understand. So one of the ones we're going to start with is the term BPE. And BPE to us stands for a basic periodontal examination. And when we're doing a BPE, what we're doing is we're using a little probe, a little gentle probe, and we're going around the gums and we're looking at what that probe sort of does, how far that probe goes into the gum. So there's a little gap between the gum and the tooth and the bone, naturally in healthy teeth, and that gap's a few millimeters. But when we have problems with the gums, that gap gets deeper and deeper, and we might get some bleeding, and we might find little bumps because there might be some deposits or something stuck on the tooth surface, and that's calculus or tartar. And that can be above the gum, it can be below the gum. There might be little fillings that have like a little ledge on them, or you might have fixed braces that have got some ledges on them. And when we're looking at these things, the reason that we're looking at these little deposits or these ledges, or whether you've got braces, is because they can all hold plaque a little bit more. So they give you a value. When we're probing around these gums and we're examining these gums, we get values from 0 to 4. And a value of 0 means that we're very happy and the gums are nice and healthy. If you hear the number 1, then in relation to the BPE, then that might mean that there might be a little bit of bleeding and we might need to give you some advice on what's happening. If there's a value of 2, again, we might need to give you some advice and we might need to help you out with a little bit of cleaning. And a value of 3 or 4 means we're a little bit more concerned about what's happening. We're seeing sort of an increase in the gum problems, maybe some deep pockets that you can't clean, and we might be looking at some bone loss around those teeth. So with certain types of gum disease or periodontal disease, we see the bone moves away from the teeth, and that's why it's important that we keep our teeth nice and clean to reduce the risk of this. And so a score of 3 or a 4 might mean that your dentist or your hygienist just needs to do some more extensive checks. So they might suggest a particular type of professional cleaning or some other types of treatment. But I'm moving away from what we're talking about. We're talking about sort of de-jargonizing those codes. So that's what a BPE stands for. It's the numbers that we use when we're looking at the gums and how healthy the gums are. So if we remember that 0s are really healthy and that the higher the number, the more poorly the gums are, with the 4 being the poorliest that we can get on that screening. And then the 3 and the 4 mean that we do some more investigation. So ideally you want to be in the 0s and the 1s, maybe the 2s. Other terms that you might hear us talk about are when we're talking about the front and the back and the sides of the teeth. So when we're looking right down on a tooth, if you imagine the tooth is square, and the side that faces away, if you imagine a center line, right down the center, so our nose is the center line, the middle of the nose, that way. And we're looking at the tooth surface and we're moving away. The back of that tooth, we call it the distal. So you might hear the word distal, and what that means is that's the tooth that goes away from the center. And then you might hear the word mesial, and that's the side of the tooth that goes towards the front of the center. So this is the center point, and it's the front part, the closest to the middle of the mouth as those teeth sit there. So if we think of like a row of houses, and we've got a street that runs down here and then the houses go that way, then the part of the house that faces the center is the mesial, and the part of the house that faces away from the center is the distal. So you might hear those words mesial and distal, and that's what they mean. And then the part of the tooth that sits next to the cheeks, we call it the buccal. So when you hear the word buccal, that is the side of the tooth that faces next to the cheek. And then on the tongue side, we call that the lingual. So the side of the tooth that faces the tongue is the lingual. And then on the roof of the mouth, we call that a palate. So the side of the tooth that faces the roof of the mouth is the palatal. So we've got lots of different terms there about which part of the tooth we're talking about. And really it's either the front, the back, or the side nearest the cheek, or the side nearest the tongue or the roof of the mouth. And that leaves one surface left, and that's the biting surface. And on the back teeth, that surface is flatter, and we call that the occlusal surface. So it's the surface, the chewing surface, the stuff that we chew with, where all the action happens when you're eating and when you're chewing. But the front teeth, if you think about those, they're sometimes a little sharp and they come to an edge, albeit sometimes that's like a flat edge. But we call that the incisal. So just to confuse things, we've got the incisal edge on the front teeth, and then we've got occlusal surfaces on our back teeth. So that sort of tells us a little bit about where the teeth are. Amilie, we also use numbers and sort of lefts and rights to talk about the position of the teeth in the mouth as well. So we have something called quadrants, and we'll divide the mouth into 4, and we'll have like an upper left quadrant, an upper right quadrant, a lower left quadrant, and a lower right quadrant. And these are what we call our quadrants. And then we can talk about the teeth in that quadrant. So when we number teeth, we number them starting at the front, and we number them in the quadrants. So we go 1, 2, 3, 4, 5, 6, 7, 8. And then we start again. 1, 2, 3, 4, 5, 6, 7, 8. But so we don't get confused with the 2 number 1s, we call this upper left 1, and then the next one upper left 2, and then upper left 3, which is our canine tooth, and then upper left 4 and 5, which are our premolar teeth, and then upper left 6, 7, and 8 if we have them, and those are our molar teeth. And that's our upper left hand side. And then the upper right hand side, we have upper right 1, upper right 2, upper right 3, and if you remember that's a canine, upper right 4 and 5, and those are our premolars, we call those premolars, and upper right 6, 7, and 8, and those are our molars. And then it's the same on the lower jaw. We start again here, and we've got lower left 1, lower left 2, lower left 3, 4, 5, 6, 7, and 8, and then the same on this side, 1, 2, 3, 4, 5, 6, 7, and 8 on the right hand side. And that's one numbering system that we use. But Amilie, just to confuse things, some dentists will use this system and they'll use upper left 1, and another dentists, they just use numbers just to really confuse it. So what they do is they divide the quadrants again, and then this becomes quadrant number 1 instead of the right quadrant. This one becomes quadrant number 2 instead of the left quadrant. This one becomes quadrant number 3 instead of the lower left quadrant. And this one becomes quadrant number 4 instead of the lower right quadrant. And then what they do is they number the teeth the same. So this tooth becomes 1, 1, and then 1, 2, 1, 3, 1, 4, 1, 5. And then as we switch, if you remember, this one was called quadrant number 2. So this is 2, 1, 2, 2, 2, 3, 2, 4, 2, 5. So you might hear some dentists use those numbers, and you might hear them mention upper left 1, upper left 2. So I hope that kind of explains it a little bit. I know it's sort of complicated, and sometimes just ask the dentist which system they're using or which tooth they're talking about, and they should explain it to you. But because as dentists, our left and our rights are mixed up because we use your left and your right, never ask a dentist directions, because they always get confused between what left is and what right is when they're giving you directions. But when they're looking in your mouth, they get it right. I hope that helps you understand a little bit about that. So other things that you might hear are words like caries or decay or a cavity. And this is where we've got a little hole in the tooth. So that means that we've had too much sugar, and those little bacteria that we all have in our mouth, we've all got bacteria. That's why we brush them to keep our gums nice and healthy. But even with lots and lots of brushing, if we have too much sugar all the time, then that can cause us to develop tooth decay, and we can get little cavities. So you might hear the word cavity, decay, or caries. and these where we see a little hole. And then we have different types of fillings that we use. And our filling is something that when we have a cavity, if we can clean that cavity out, if it's small enough to do that, then we'll clean away all the poorly part of the cavity. So we've just got a healthy tooth left. And then we've got a little hole left. So we need to fill that hole up. So we call that a filling or a restoration if you're a posh dentist. And we use different things to fill the teeth with. So one of the things that we used to use a lot, we don't use it so much these days, is a silver filling called amalgam. And that's one of the metal fillings. So amalgam is sort of a mixture of different products, and it has this silver appearance to it. And then that's packed into the cavity, and that's your metal filling. So we tend to use that more towards the back because it doesn't look very pretty. And then we have the white fillings. So again, it does the same thing. It's used to fill the hole, and that's called a composite filling. And there are different ones. There's also something called glass ionomer, but essentially that's what a white filling is. And that's called a composite filling. That's commonly used on the front teeth, and we're using it more and more on the back teeth these days as well. So that's an amalgam filling and a composite filling. We also have little things that go over the tooth, or big things, depending on what type of tooth it is. And that might be called a cap or a crown. So when a tooth is really badly damaged and there's not enough tooth left for us to put a filling on top, we might cap or crown that tooth. So that means we've got to take a little bit of the tooth away, but we need enough space to be able to get the cap, which fits all the way around the tooth and on the tooth, and that protects the tooth. So that's a cap or a crown. And you can do these on any tooth. So you might have some on front teeth, you might have them on the back teeth. And you might have white caps. You used to have gold caps. So there's different types of caps that you can have as well. So I hope that helps you for the start of some of the terms that we kind of talk about in our dental jargon when we're talking gibberish, and just helps you kind of understand a little bit about it. I'll do some more videos and hopefully just make things a little bit more clearer. Hi, Amilie. One of the terms that we sometimes talk about when we're talking about teeth and things like that are sort of what's happening on the outside of the face. So one of the terms you might hear are TMJ, which stands for temporomandibular joint. And what we have here inside our skull is a little joint, and it moves, it hinges. And that's our lower jaw is able to sort of open and close. And what we sometimes do is we'll just put our fingers nice and gently where that jaw joint is, and we'll sort of feel and listen how it opens. And if it's working well, then, we shouldn't really feel much apart from the movement. It should be a nice, smooth movement. And when you're nice and young as you are, you shouldn't really hear any noises. But sometimes we hear like clicks. The jaw joint can be a little bit painful when it opens. And that helps us understand if there are any problems that we can help with. So that's the TMJ, or the temporomandibular joint. That's one bit of jargon that we talk about here. Other ones are nodes or lymphadenopathy. And what we'll do is we'll just check the nodes. So we'll just have a little feel around the neck. And we've got these little glands, which are a little bit like our immune system, I guess. And in our immune system, we have these little nodes like tiny balloons. And if everything's nice and healthy, those tiny balloons are very soft, very fluid. But sometimes, I'm not sure whether you've had a throat infection, but it can swell up a little bit. So those little glands or nodes, when we're feeling around there, they might feel a little bit firm, or they might feel a little bit tender. So that's one thing we're checking for down here, are the glands and the nodes. Just checking that everything is nice and healthy. And we have what we call salivary glands that we can sort of feel as well. And we can sort of feel these on the inside of the mouth as well. And these glands help produce the saliva or the spit that we have. And as I'm talking to you now, I can feel my saliva is drying up and I'm getting a bit of a dry mouth. So I need to get a drink of water. But we're just checking, again, when we're having a good feel round. It's not always easy to check our salivary glands, or our spit glands, I guess you could call them. But essentially what they do is they lubricate our mouth. So they make it easier for us to speak. And they keep everything nice and fluid. So they help kind of almost get rid of some of the germs that are in our mouth, keep it nice and dry, keep it nice and moist, and stop it from getting dry. So there's lots of things helps us swallow. It's one of the big things if you think about when you've got a really dry mouth and you're trying to swallow something, how difficult that can sometimes be, and sometimes why when you're taking tablets you need a little glass of water and things like that. So I hope that kind of gives you a little bit of an understanding about some more of the jargon that we use.